All right, this will be an intro lab quiz. We're just gonna kind of, like we're gonna do with all the quizzes, I'm gonna give you time to answer. So I'm gonna ask the question, you're gonna have time to answer. You can either pause in between. I would recommend pausing until you know what the answer is, and then you hit play, move on to the next one. Then once we've gone through all the questions, at the end, I'll pause for a second. I will say that that was the last question. You can stop, go back, review your answers, okay? And then hit play again, and then we will run through all of the answers, all right? That way you should treat this like a regular quiz, at least timing-wise. So you pause if you need to. If you need more time to answer, then hit play, move on to the next question, and at the end, you'll be able to pause, before all of the answers come through. All right, so question number one. If I am moving in this direction, all right, name the plane that my arms are moving through. That's the first question. There. Question number two. This will be a positioning question, so you're going to use directional terminology to answer this. I want you to tell me relative to this point and that point. So from here to there, I want to know what term would you use for this point relative to this point here. The directional term you use to name this point relative to this point. Number three, if we wanted to talk about what is the relative position between my skin and my muscles, what directional term would you use to say what is the position of my skin relative to my muscles? Number four, all right, number four, I'm going to demonstrate a movement. You're going to name that movement. So start here and here, like that. All right. Start here and there. Name that movement. Number five, another movement. I'm actually going to do this from the back. I think it's easier to see. So start here and here. Begin here and there. I want you to name that movement. Number six, we'll try to show this down here. I want you to name this movement. Start here and there, like that. Begin here and there. Name that movement. Number seven, I want you to name this movement. If I start here and I move this direction. Now the movement is occurring here, okay? So what movement is occurring at this joint here if I move in this direction? Like that. Number eight, if I move my arms in this direction, I want you to tell me what plane are my arms moving through? What plane are my arms moving through if I'm moving in this direction? Number nine, again, we're going to go back to this point and this point over here, and I want you to tell me what directional term would you use to describe the location of this point relative to this point? What directional term would you use to describe the location of this point relative to that point? Number 10, I want you to tell me what directional term would you use to describe the location of my organs relative to my skin? The directional term that you would use to describe the location of my organs relative to my skin. Number 11, this one's going to be a movement. And here, I'm going to do this in a particular area, right? So we're going to start here, and we're going to end here, like this. Begin here, end here. So if it's not clear by what I'm doing, the movement that we're showing is occurring in this region here, all right? So again, start here, end there. Number 12, I'm going to turn around again. I think it's easier to see from the back. So here, we're going to name this movement. We're going to begin here, and we're going to end there. All right? Begin here, end there. Name that movement. Number 13, we're going to come here again. And we're going to name this movement. We're going to begin here, and we're going to end there. It's a slight movement, but hopefully you can see it. And again, we're concentrating down here, so we're seeing starting here, end there. Begin here, end there. Number 14, last one for this quiz, is if I stand here, I want you to name what this position is called. All right, that's the first part of this. Name what this position is called if I stand this way. And then using the directional terms that you know and the movement terms that you know, I want you to fully describe this particular position. All right, both of those things. All right, so at this point, pause it, go back over your answers. When you're ready, hit play, and we'll go through all the answers. All right, so I'm gonna grab the paper here so we can kind of look through. All right, so first one was moving my arms in this direction. We're going through the sagittal plane. You also could have said anterior, posterior plane. For the second one, we're looking at 2 points, and we want to know how would we describe this point relative to that point. We'd say that this point is medial to that point. For number 3, we want to describe what's the relative position of my skin relative to my muscles, and we'd say that your skin is superficial to your muscles. For number 4, we wanted to name this movement here, and we said that that is going to be lateral flexion. Now here, I laterally flexed my entire spine. If I had just done something like this, we might have said lateral flexion of the cervical spine. If I had done something like this, where I'm moving more in this area, we just said lateral flexion of the lumbar spine. I did the whole thing, you just say lateral flexion of the spine. For number 5, that was when I turned around and we did start here and there. That would be elevation of the scapula. For number 6, I was moving my ankle joint from here to there, and we'd say that that's inversion, right? You can say inversion of the ankle, but we can only invert in that one spot, so you can just say inversion. Number 7, I was moving my arm in a circular motion like this, and we were saying the movement is occurring here at my shoulder joint, so you'd say circumduction of the shoulder there, or circumduction of the arm at the shoulder. And number 8 was if I move my arms this way, what was the plane? That would be the horizontal or the transverse plane. Number 9 was going back to 2 relative points here. We want to say, what is the location of this point here relative to this point? And that would be that this point is lateral to this point. Number 10, another directional question. We said, what's the location of my organs relative to my skin, right? Or I might have said relative to my muscles, but, and what you're going to say is that your organs are deep to your skin or deep to your muscles. Number 11 was to name this movement. Start here, end here, and that is going to be rotation of the cervical spine. And I even noted that we were making sure that the movement's occurring in this area. I could have shown it in the lumbar spine or something else, but there it was, rotation of the cervical spine. Number 12 was the name of movement. So it was here, it was start here, end there, and that one was depression of the scapula. Then number 13 was again down at my ankle joint to start here and end there. The movement's slight, but I am doing eversion of my ankle there. Eversion. And then the last one was to name this position, and that's anatomical or reference position, either way, and then describe it as best you can. All right. Now this is going to bring in a whole bunch of things, right? If we're in this position, we can say that, all right, my palms are anterior, my face is facing anteriorly, my toes are facing anteriorly. That's one thing. We can say that my scapulae are depressed when I'm in this position. We can say that my forearms are supinated. We can say that my arms are externally rotated in this position. We can say that my arms are adducted, D as in dog, they're kind of against my body here. What else? We can say that I'm fully extended in this position, so all of my joints are at full extension right now. We can say that our scapulae are inferiorly rotated when we're in anatomical position. That's enough. If you got most of that stuff, or at least some of that stuff, I think you're doing a good job. But you can, the more terms you have, usually you can go back to anatomical position and more fully define what anatomical position actually is. All right, that's the end of this quiz, and we'll see you on the next one.